Hi everybody, welcome to Dr. Manny's YouTube Learn Shops. What we're going to review is an integrative holistic assessment. Again, it can apply to nursing and any other healthcare professional. Now, the holistic health assessment considers multidimensional aspects in relation to wellness, and it encourages healthcare professionals and providers to recognise the whole person, holistic. You're looking at physical, mental, emotional, social, intellectual, spiritual, financial, and occupational aspects, which is the focus of the whole patient client. And it's not just about illness. It's looking at the patient or the client as a whole. Now, when we do that, we need to consider lifestyle considerations. And as much as I like burgers, I think I'd rather be as the second client there is rather than the first. Why is a lifestyle health assessment important for patient care? Well, in our current society, typically Western, it's more popular to take medication or have a medical procedure rather than make lifestyle modifications, even when those changes could improve the overall health of the client. And the reality is that in many diseases and disorders, they're preventable and can be managed with the right lifestyle choices. The lifestyle choices may not be as attractive as eating a delicious McDonald's burger in comparison to a lettuce leaf, but lifestyle assessments provide detailed information to evaluate what care the client requires. Now, in relation to lifestyle considerations, it may be important to ask, what's the description of a typical day? And this provides an overview of how the client sees their usual pattern of activities of daily living. You can ask vague questions to allow the client to explain without prompts. For example, please tell me, what is a typical day like for you? You could start, for example, with when you wake up in the morning and continue till bedtime. And if the client gives minimal information, then you can probe more and ask specific questions to get more information. In relation to lifestyle considerations, nutrition and weight management. You can ask the client, for example, what consists of a typical day? And these questions can reveal things about food habits, whether they're good or bad. Emphasis is on foods eaten and in what amounts. This can include things like snacks, fluid intake, and others. Example questions could be, tell me what you eat in a typical day. What foods do you prefer? How often do you eat? How much do you eat? How much fluid do you drink? What type of fluids do you drink? You could ask the client about their activity level. How active are they in a typical week? This could be at work or it could be at home. You could ask about whether they do and perform regular exercise. You could point out, for example, that while you're at work, the physical activity may be stressful and it may create fatigue. However, if you do recreational exercises, this could relieve stress and increase the stress. So example questions could be, what is your daily pattern of activity? What types of exercise do you do? Do you follow a regular exercise plan? What do you do for leisure and recreation? Did you know regular exercise reduces the risk of heart disease? sleep and rest are always important. You can ask the client if they feel they're getting enough sleep. Questions could focus on, for example, sleep patterns, quantity, how long, quality, how much. Example questions could be, tell me about your sleep patterns. Do you have trouble falling asleep? How much sleep do you get each night? Do you feel rested when you wake up? Do you nap during the day? Compare answers to normal. For example, normally an adult sleeps between 5 and 8 hours per night. However, age, health and stress levels can affect these sleeping times. What about asking about substance use? And this provides the nurse with an overview of how the client sees lifestyle and self-care ability. Substances can affect the client's health, cause loss of function, impair senses, increase the risk of disease, interact with prescription medications. Example questions could be, how much beer, wine, alcohol do you drink on average? Do you drink coffee or beverages with caffeine? Do you smoke cigarettes? Or have you ever? Do you take vitamins? Have you ever taken non-prescribed medications? Then there's the concept of self and self-care. And this provides the nurse with an overview of how the client sees themselves and their health promotion behaviours. For example, could be, are they responsible in respect to sexual activities, basic hygiene, health checks, breast or testicular self-examination, hazard protection, things like seat belts, helmets on motorbikes, sunscreen. Example questions could be, how do you feel about yourself? What do you do to stay healthy? How often do you have a medical checkup? How often do you have a dental checkup? Do you practice safe sex? Do you drive safely? Then there are social activities. And this provides the nurse or the healthcare provider with an overview of what outlets the client has to support and for relaxation. If the client is involved with the community beyond their family and their work. This determines now the client's current level of social development. Example questions could be, what do you do for fun and relaxation? Who do you socialise with? Are you involved in community activities? How do you feel about your community? What do you see as your contribution to society? Relationships are another factor in lifestyle considerations. You could ask the client to describe the composition of their family into which they were born. You could ask about relationships, past, current, with family members. And this assesses the potential support and problems from the client's family origins. This also assesses potential support and problems from the client's current family. Example questions could be, who is or are the most important persons in your life? Describe your relationship with that or those persons. What was it like growing up in your family? What is your relationship with your current partner? What is your relationship with your children? How do you get along with your in-laws? Do you have any pets? What is your role in the family? Then there are the values and your belief systems. And this assesses the client's values, philosophy, religious and spiritual beliefs. And this information may identify important strengths and weaknesses, which could be problems. It's important to note that some clients may not consider their values and beliefs. They may not feel that it's appropriate to mention them to you, and this shouldn't be pushed and it should be respected. Example questions could be, however, what is the most important aspect in your life? Or what's most important in your life? What do you hope to accomplish in your life? Do you have any religious affiliations? Is that religious affiliation important to you? Is your relationship with God an important part of your life? What gives you strength and hope? Then we have education. And education could be related to work environment. And this provides the nurse with an insight into regarding stress and satisfaction in the client's life. Discussing this aspect can make the client feel good about their accomplishments. And it identifies also issues that may need to be addressed to promote increased satisfaction. So for example, questions could include, tell me about your experiences in school. Are you satisfied with your level of education? Do you have plans for further education? Can you tell me about your work? Do you enjoy your work? Who is the primary provider in your family? Does your current income meet all your needs? We all have stress, and we all cope with stress in different ways. However, as a lifestyle consideration, this provides the nurse, the healthcare provider, with an insight in regarding the amount of stress and whether coping strategies are effective in the client's life. Ask questions that address what events cause stress and how they respond. It also identifies how the client relieves stress or behaviours with activities that are adaptive or maladaptive. Example questions could be, tell me what makes you angry. How would you describe your stress level? How would you manage anger or stress? What do you consider the greatest stressor in your life? Where do you go for help in a crisis? Then there's the environment. And in respect to the environment, this asks the client to think about their environment, to assess potential hazards in their lifestyle. And this considers physical, chemical, psychological situations that may put the client at risk. And they can be found in clients' neighbourhood, home, work, or the recreational environment. And they may be controllable or uncontrollable. Questions could be, for example, what, if any, are the risks in your environment, home, neighbourhood, or workplace? What type of precautions do you take, if any? Do you believe that you are ever in danger in respect to violence? It's also important to consider psychosocial considerations. Psychosocial seems to be difficult to understand, but it basically means pertaining to the influence of social factors on the individual's mind or behaviour, and to the interrelation of behavioural and social factors. Sounds complicated, but essentially a psychosocial assessment is an evaluation of the client's mental health and social well-being. It assesses their self-perception and their ability to function in the community. And the goal basically is to understand the patient and how to provide the best possible care and help them obtain optimal health. Really, it's to determine if the patient is in a mental health or in a mental health illness state. Mental health, by definition, is a state of well-being where one can deal with typical stresses of life, work productivity, and contribute to the community. Mental illness is a pattern of behaviours troubling the person or the community where the individual lives. And mental illness, really, may modify reality, influence daily living, and harm an individual's judgment. And these individuals have a reduced ability to cope with society, maladaptive behaviours, and affects their ability to function. What are some of the major components of a psychosocial interview? Well, similar to what we've mentioned before, which you can review in this slide. When it comes to cultural considerations, we're all different. And in a health assessment, cultural considerations are important. And it's important for the healthcare provider, whether you're a nurse, a doctor, a paramedical provider, to always ask about ethnic background, religious preferences, family patterns, food preferences, eating habits and patterns, and healthcare practices. Because we're all the same as human beings and we're all different. So before the health assessment, the nurse must be aware, which is culturally aware, and therefore culturally competent to assess clients and their family members, because this can offend them and therefore have a negative impact on their health care. Examples could be related to language, eye contact, gender, touching. Now we'll move on. We'll move on to other aspects related to health assessment. And these are related to terminology. So it's important to understand body positions. And the body positions that I've put here are supine, prone, lateral, recumbent, whether it's right or left, the Trendelenburg position, and the Fowler's position. This is essential terminology when doing a health assessment. Then you've got body regions, and the body regions, which again you should be familiar with, include the head, neck, the upper limbs, the thorax, abdomen, pelvis, which are in the trunk, and the lower limbs. When we look at the abdomen, it's important to know your 4 quadrants. Your 4 quadrants are the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. And it's important to have an appreciation of what organs lie under these quadrants. Then you have the 9 regions. There are 9 abdominal pelvic regions, which are very important for pain assessment, for example. You have the right and left hypochondriac region, which basically means under the ribs, hypochondriac. You've got the epigastric region, which is just above the stomach. Then you've got the umbilical region. You've got the lumbar region, right and left. You've got the hypogastric region. And you've got the iliac regions, right and left, which further diversify the abdominal pelvic regions, where organs can be identified, especially when pain occurs. So when it comes to physical examination, as an introduction, we have certain approaches. And the 2 most common approaches are the body systems approach and the head to foot examination. In the body system approach, This requires a physical examination to be done on each individual body system. Or you can follow through with the head to foot examination, and this requires the nurse to start, or the healthcare provider, doesn't have to be the nurse, the healthcare professional or provider to start at the client's head, moving down the body, noting all related issues. I'm going to review this reasonably quickly. Then you've got the body systems, which again is the integumentary system, which we'll look at in a little bit more detail in other Learn Shops. Integumentary system consists of the skin, the hair, the nails, and look, the skin is the largest organ in the body, and in an adult, typically 6 square meters. It provides protection, prevents dehydration, maintains body temperature, and allows touch, heat, cold, pain to be sensed, vitamin D synthesis, and provides skin colour in the melanocytes. Then you've got the nervous system, which consists of the central, the brain and the spinal cord, and then all the peripheral nerves. And essentially, it provides motor and sensory functions and responds to internal and external changes continuously. You've got the cardiovascular system, which incorporates the heart, which is a pump, and all the blood vessels, arteries, veins, capillaries, and the transport media being the blood, which consists of erythrocytes, leukocytes, plasma, and thrombocytes. Then you've got the pulmonary system, which is the upper and the lower. And typically, we've got here the pharynx, the larynx, trachea, bronchi, and alveoli. And essentially, this is to allow us to breathe and provide gas exchange. Then you have the kidneys, the renal system, which consists of the nephrons, ureters, urinary bladder, urethra. And the objective is to eliminate nitrogenous wastes in the form of urea and creatinine and excess body water, and maintain acid-base balance, as well as numerous other functions. Then you've got the musculoskeletal system, which in the skeletal system provides structure and a framework, and the muscular system provides movement. The digestive system commences at the mouth and ends at the anus. And the functions are essentially to ingest, secrete, digest, absorb, and eliminate. The lymphatic system is our immunity. And it prevents also peripheral edema. It maintains fluid balance and transports lipids. But essentially, it consists of ducts and nodes and lymphatic capillaries which provide our immune system. Then you've got the reproductive system. In the males we have the testes, in the females we have the ovaries. The objective of the male testes are to produce spermatozoa and certain male sex hormones, in particular testosterone. The females, their ovaries produce and store ova and female sex hormones, in particular estrogen and progesterone, but also a small amount of testosterone. The endocrine system consists of ductless glands, and their objective is to secrete hormones, which are chemical messengers. And the main glands could be the pituitary gland, which has an anterior and posterior component, the adrenal glands, the parathyroids, the pancreas, the thyroid. And their main functions deal with metabolism, reproduction, and stress responses. So when we look at health assessment, we've got certain components. And preparation before assessment is important because this sets the environment. So it's important to make sure that the environment is clean, warm, quiet, and well lit. Ambient light is better than bright light. And relatives and friends can be with the client to give support. A first-time physical examination may be a worrying experience, so it's important to provide privacy. You don't expose body parts unless they are necessary, and you always use drapes, sheets, or a blanket, and to be respectful, to provide the client with dignity. Equipment could include all these components, but again, all these are just examples. And for example, if you were doing a physical assessment on the skin, then the important thing would be inspection, a light to see. Palpation, well, the tools really are your hands. However, gloves may be important in respect to body fluid contamination. Auscultation may be necessary depending on what part of the skin you may be wanting to examine. But the equipment depends on what examination is required. Inspection, palpation, percussion, auscultation. In preparation, you as the nurse or as the healthcare provider should remember the 5 moments of hand hygiene, and this is a simple act that will increase client-patient confidence in you as a conscientious professional. You are also expected to use personal protective equipment if required. And this can include a gown, gloves, mask, goggles, hair cover, shoe cover, but only if it is necessary. Which means if any infection is present, or body fluids or open wounds that could place you at risk. However, it's really important to understand the basic skills of physical assessment, which means inspection, palpation, percussion, auscultation. When it comes to preparation of the client, you explain to the client, the patient, what you're planning to do and why, and if they consent. Make sure the client clothing doesn't interfere with the physical examination, so provide a hospital gown. Make sure the client empties their bladder or bowel, if necessary, before the examination, so that it isn't interrupted or it doesn't alter your findings. A full bladder and a full bowel may cause some form of distress. Help the client to relax as much as possible, and always place the client in the appropriate position and make sure that it is typically comfortable. That's the end of this holistic introduction to health assessment. If you found this Dr. Manny Learn Shop of any value, please recommend it to your colleagues, and please subscribe so that you're notified of any future Dr. Manny Learn Shops. Take care and God bless, and see you in the next session.